So this is Keith Caldwell, founder of OurSpecialNeedsChildren.org, and Dawn.
Dawn, staffer at Our Special Needs Children.
And we are here on the phone with Cynthia Long, and she is going to introduce herself and her company to us, and we're going to ask some questions regarding her services, her company, and her impressions and thoughts of the autism bill that was passed last year. So, hello, Cynthia.
Hello, I'm Cynthia Long. I'm one of the owners of Square One. It's an in-home ABA provider in the greater Sacramento area for children with autism.
Excellent, excellent. So you're one of the owners of Square One, and I was fortunate enough to have had my child see you guys for a couple years, and you guys do great work. How is Square One different from other service providers in the Sacramento area?
Square One does not employ tutor-level staff. We only have bachelor's level and higher staff that work directly with our clients and then teach parents how to implement the ABA strategies that we're using. In addition, we also are really using more of a play-based approach of ABA and not doing tabletop activities, but rather following the child's lead and then trying to incorporate any area that we're trying to increase their skill level or decrease if we're talking about behavior excesses.
Now, how long has Square One been around?
Square One's been in business for 5 years now.
Okay. And you guys are ALTA-approved vendor, is that right?
Yes.
Excellent, excellent. What do you see as the most challenging part of your role as a service provider currently?
Well, in the purpose of this interview, I know we're talking about the health insurance bill. That's really been kind of the biggest challenge to me currently is having to switch over a lot of the current clients that I have that are regional center funded over to their health insurance and just managing what insurance requires, what type of, they have different intricacies about what they need from us or which type of staff can staff the case. So managing all of that has been a challenge.
So has there been cases where staff that was with a certain child is no longer with that child or has been reassigned for some reason?
Yes. Mm-hmm.
Oh, and that, from your experience as a professional, that's not a good thing for children on the spectrum because they like consistency and thrive in that. Is that right?
Exactly. And, in order to move a certain staff member from one case, that means we probably have to change a different case just so they can swap and, that other client just happens to be one that has to be affected as well. So it doesn't just affect the child who is now receiving services through their health insurance provider.
Interesting, interesting. I think that's sort of one of the unintended consequences that no one really sort of thought through about this whole bill. Interesting.
Uh-huh.
Have you had any clients thus far who said this is just too much to deal with and I'm really not interested in pursuing it?
We've had one client who wasn't previously a regional center child. I don't know if he was eligible for regional center or not, but they started services with us and had some level of copay or coinsurance. I don't know all of the specifics, but basically through the process kind of decided that they didn't want to move forward with it. And I'm not sure if it was a financial decision or if it was more of just dealing with the process decision. Otherwise, everybody's pretty much been trying to, everybody else, they really want to keep their program and they want to keep it as consistent as they can. So families have really been, going through the ringer as far as, I've had some families who have been on the phone with the health insurance provider for hours and hours trying to get it worked out so they can get switched over.
I know it's affected my family as well. Have you heard from anyone in terms of how the reimbursement occurs from ALTA? Are they reimbursing the deductible and the copays, or do you know anything about that at this point from what your clients are saying?
Well, I actually heard that information directly from one of the directors over at the regional center in a recent meeting, and she said that the regional center was definitely, this regional center was deciding on their own. It was not it wasn't a directive from DDS. So they decided on their own that they would be funding co-pays. And I believe also co-insurance, which can be like a percentage of the program, although I know that's a lot harder for them to manage because, it's not a straight $5 an hour, $10 an hour. It's
right.
going to be a different number. But they definitely are not funding deductibles. And the reason that she cited for that was that deductible basically is for the entire family. And this regional center can't be covering a deductible for a whole family when it's just one member of the family who is receiving the service.
Well, unless all the kids are autistic, but that's another issue. So has anyone received reimbursements yet? Is it still working it out? I mean, this is all effective July 1, and now
It's all still really getting worked out. I don't think we haven't gotten paid for any co-pays yet. We're starting to get paid by health insurance companies, but health insurance companies can take up to 45 days after you bill them to either pay you or to tell you that something is wrong with your billing and, so that you can try and fix it. So it's taking a lot longer than I think we anticipated that it would really get ironed out.
And feel free.
Some of my families are still in the beginning phases of, in fact, I was just sitting here working on a current treatment plan for a client that I currently have, but the health insurance company needs something different from other than the usual update report that we've been providing to the regional center. So I need to go through and reformat a report to give to the health insurance company because they need something slightly different, and that hasn't even switched over yet. So we're still working on a lot of the current cases that we had getting switched over.
Feel free to say I'm not answering this question, but is the rate of reimbursement similar, comparable, or much lower or higher than it was with the regional center?
Well, Square One is in a different position than a lot of the other ABA vendors, all the other ABA vendors in the area, in that we don't employ tutor-level staff. And most of the rates that we've been given, they give you a rate for what they call paraprofessional or tutor-level staff, and then they give you a rate for supervisory, which usually requires the person to have a BCBA, which I do have, and several people at our company do have, but not all. And the tutor rate that we've seen, and it's been different across each health insurance company. There's no standard rate that any of them are providing. It definitely seems like they're trying to kind of lowball and see what they have to do, see kind of what they can get away with, I guess. But, the rate that we're seeing for paraprofessional is looking like, that's a pretty decent rate, and you could, if you were employing tutor-level staff, could possibly help cover the lower rate that you're seeing on the BCBA side. But since we're only really employing BCBA or BCBA comparable staff, we're having trouble in that, we can't take a loss per hour. Obviously, we need, we're in business because we need to pay our bills and make money. So it's been a challenge and definite nail biter.
Well, I'm curious to ask you, before the bill was implemented, and were you a champion of it? Were you a strong believer in it, or were you just sort of like, we'll wait and see?
I was pretty worried about it. I thought, I thought a lot of the things that I think are actually coming to fruition now, in that there's so many different insurance companies out there that we would have to try and contract with. What would that be like versus just dealing with one regional center? And, going into the autism business, it definitely has its pros and cons, but one of the things that was pretty easy about starting the business itself was that once you were vendored with the regional center, then you were contracted with the regional center, and you really only had to deal with billing one entity, and they pay their bills well, and, so we had it pretty good before, honestly. And so I was worried about, having to deal with so many different entities, and that really is kind of coming to be at the forefront of the problem. Each different insurance company wants different things, and maybe as as I continue to go through this, maybe I'll start to see more patterns and understand their process more, but I just don't understand their system very well, and that's been hard too. Plus, insurance companies don't really understand, and we saw this more at the beginning, like around July, we would call in and they didn't even really know what ABA was or how to really categorize it, and they were asking for people with licenses. Well, there's no license in ABA in California right now, and so it's that's really been a challenge, and so no, I wasn't really real hip on it to begin with. Plus, I mean, I guess this is a bit of a political statement, but I feel like it's pretty much the same pool of individuals who are funding these services for clients, whether it be California tax dollars or people who have health insurance. It's pretty much the same pool of people. So it's just kind of money coming out of our pockets in a different way.
Right. That's interesting because if my insurance company, if I understand this right, Cynthia, if my insurance company said, we don't support ABA services, then it would be back to business as usual for me, right?
If
I
your
would get my
insurance company
through Alta. I wouldn't have any co-pays. I wouldn't have any deductible issues. It would just be all funded by Alta. You guys wouldn't have to deal with go to this insurance company for that and all these additional things. Is my understanding correct?
Well, I mean, the insurance company by law can't do that right now, but
there's the legislature, as I understand, they've exempted themselves in some areas, or at least some of the government workers. I read the original bill, and it seems to be that they've exempted the California public retirement system from having to comply with this bill.
Yeah.
Were you aware of that?
Yes. We had a client who had health insurance through a federal. I think his employed parent was like a federal employee of some kind. Anyway, they were exempt because of that, because of how their insurance came through. Other interesting exemptions have been if the insurance is purchased from out of state, like the main company is out of state, even though the insured works here in California. I've seen exemptions for that, which I guess, how can California really impose that on an insurance company that's from another state? But that was an interesting exemption too.
Yeah, I hadn't heard of that one before. That's interesting.
Yeah.
So it's just interesting to me how the law's sort of been implemented and how the legislature in some ways has exempted themselves from things that maybe they sort of foresaw some of the challenges that are out there. I guess I'm still just in a wait and see with this bill to see if it really was everything that was promised to be, or if it's going to be revoked, or whatever the phrase is, rescinded, whenever it comes up again.
Sunset. It's set to sunset in 2 years, I think.
Oh, in 2014?
Yeah, I'm pretty sure.
Dawn, I've been sort of dominating the conversation. Did you want to ask Cynthia something?
No, I think that was all really helpful information that people may not have thought through as far as how that's going to work for service providers and how that impacts the families now to have this whole new system where both sides don't know how to work together yet.
Right. Hey, Cynthia, I'd just like to ask you just the last couple questions, if I could, because one of the things I found as a parent of a child with special needs is I get my best resources from people who know, and they just find things in passing. What have been some of the greatest or best locations, sources for resources that you've come across for parents who have special needs kids, whether it's financial considerations, health considerations, or just general information about how to help parents understand better what their things that are available to them are, if that makes any sense?
Yeah, I wouldn't say that I know of any one central kind of location for something like that. Mainly it's been either kind of word of mouth. They know from another family, or I know resources just based on my experience, what I've come across and what I've found from talking to other professionals. They'll turn me on to a new resource, or whatever it may be, whether a book or like documentary or, anything like that. So I don't think there is kind of one central location for something like that.
All right. It'd be nice to have something like that. Now, I always ask this question to everybody that we talk with because I think it's interesting, especially for people who are in the community. If you could create a bill all on your own for special needs, what would it be? What would it look like? If you were the one who was able to write it, pass it without going to any legislative process, what would you want to do? I'll give you an example of what I would like to do. I would like to have a bill that would be a tax credit for parents who have special needs kids, because nobody can tell me that it doesn't cost me more money to have a child with special needs than a child that's without special needs. So if I could create a bill, I would find a way to provide a tax credit for parents with special needs kids to help pay for some of the additional costs that we have to incur for some of the things we have to do for them. So that's an example of what I would do. Do you have any ideas what kind of bill that you would create if you could?
That's a good idea, especially with the health insurance stuff, coming down, because there definitely is going to be additional costs on top of whatever additional costs you basically already had. I think you are right on that it probably does cost more, to have a child with special needs than to have a typically developing child. If I was going to write a bill, I think honestly, I know that ABA for children with autism is not cheap, but I've always wished this, that people, whoever crunches the numbers, could look at what does quality early intervention, how much does that save the state in the long run? Because if you don't give these kids programs, if you don't give these families resources when kids are young, what is the system? What's the cost to the system going to be? Because those individuals are not going to be able to be as independent long term. So it's a short-term solution. It's taking money off of the books now, which I know obviously California needs to do, but I think this is short-sighted, and I would probably just rescind this bill in general and put it back to kind of what it was before.
I think that's a very, very, very good idea. Now, Cynthia, I'd like to have you tell our listeners what your website address is and the phone number to reach Square One if they need to.
Oh, sure. Our web address is www.square-1.net. And if you wanted to call me, you could call me at 916-606-2756.
All right. Well, thank you. Don, do you have anything else to say, or Cynthia, have anything else you'd like to say to close?
I do not have anything else. That's great.
Well, thank you, Cynthia, for your time. We appreciate it, and I'm sure we'll be in touch with you soon.
Okay. Good luck.
Thanks. Bye.